data components that are already included, whereas race and ethnicity and language would be quicker to implement. But Steve, you made a good point that there could be a delay for some of the data components.
Okay.
Yeah, this is Chris, the Senior Data Exchange Manager at the Department of Health. And for adding, the additional granularity for race and ethnicity and the language, we think we could do that based on the estimated timeline, of having the rules effective in late 2021. I think I would just point out that while the Department of Health Systems might be able to be updated, in that amount of time, the national framework is the other thing to consider. Would our partners be ready? That's something we can't answer, and still it's tied to the national standards that they build their systems off of, where that could create some challenges. But I think for those three things, the additional granularity in race and ethnicity and the language, we believe we might be able to accommodate that for late 2021.
So I don't know if this would be for you, but possibly for Ciara, when would be the next time that this role could be opened up to, if we went on and approved moving this forward, when would be the next time to come around to open the role up, at which time we could be really intentional about the collection of race, ethnicity, language, sexual orientation, gender identity, and disabilities?
I think that question might actually be for Michelle Davis, if I can.
Well, you did such a great job. I know you have some answers there, but Michelle, could you?
Okay, so technically, the way rule development works is a rule has to be in effect for us to amend it. So right now, the goal would be to include in the notifiable, the next draft that we would be reviewing in March. My understanding is we would be including race and ethnicity and
we're good for time.
Somebody needs to mute, please. And it would include language, those three elements. So the question of when can we begin work on the remaining elements and the broader piece is it's a really good one, just because we would need the rule to be in effect to start that work. And if the rule goes into effect in late 2021, then it would start sometime after that. And I'm sorry, I can't give you a date certain. I think part of our challenge will be, let's getting the proposed rule, hearing the proposed rule, and then understanding the system upgrades as they go along. I feel hopeful with that we'll get the first three in 2021, just based on the estimates we've heard from Department of Health. I think we still have to get some bigger clarity around the other categories. And I imagine, one of the things we need to do is also see how other states, if they are making these same changes, and where else we can pull from. And I think one of the pieces of feedback that we received, at least from the laboratories, is we might need to think about where the best place to collect this type of information is. In an ideal world, we would have an electronic record. And the moment that somebody was, being tested for a certain disease, that information would be readily available. And I think COVID-19 has really exposed how much growth we need to do in this area, with the drive-through clinics, which are incredible in terms of the volume that they are able to do. They're dealing with paper and fax. It's not an electronic system. where they're collecting that information. And so I think getting our arms around how big the system change is and how we incorporate all of the things we want to achieve is still some work that we have to do. And John, if you have any insight to add to this, it'd be super helpful.
I don't know that I have insight to add other than the desire to, if we go with this two-step approach, because I had this very same question, how quickly can we go to the next process? And, you know, that in part requires the board, I think, to look at all the other rules that are out there pending rulemaking and decide what the priorities are. But I would like to see it be a priority, but I won't be the secretary at that point.
Okay, board members, other questions or comments for either staff or the Department of Health?
Yeah, just I guess a question as we finalize the rule, can we put in the intent to move to that as soon and put it into the rule to move to that as soon as feasible or something like that, or does it need to have that? Because some of this may in fact take monetary resources to accomplish that. So maybe the legislature won't fund it unless it's actually spelled out in the rule that it has to happen. I don't know. It's just a question.
So this is Michelle again, and I think that, you know, based on our experience with newborn screening, and it was a question that I raised to Chris and his team, is this a question in terms of would Department of Health need an infusion of additional funds to move this process forward? And it's my understanding that that may not be the case right now. It's balancing all of the other priorities that they have in play. And I think it's our ability to get our arms around how we might define disability, how we might define gender identification and sexual orientation. With newborn screening, what typically happens is we do need to get the legislative support before the rule can even go into effect. I don't think we're in that space right now as it relates to race, ethnicity, and language. So it is a little bit different than newborn screening.
Well, very complicated matter. Board members, we do have a recommendation from staff, but before that, John, did you want to offer something else?
Can staff just summarize once again very quickly, moving forward? I know the time frame if we don't add the other data elements. What again was the bottom line if we added the other data elements?
So it will delay the hearing 5 to 7 months. I don't think there's much wiggle room there because we need this to be community informed. So that's the very minimum. And then how long it would delay implementation, I saw Chris hop on, so I'll let you answer that piece.
Yeah, for the technical pieces alone, just the system changes, I think we were estimating, you know, potentially another 12 months. And a lot of that, you know, has to deal with, again, not being certain how long a lot of these COVID projects are going to occupy, you know, our resources and attention. But the key challenge with some of those additional fields that want to be added, you know, is that they don't currently exist in the HL7 standard at all. And so while we could even potentially build them into our system, a lot of our partners, if you want it to come from the lab, you know, wouldn't have a technical way built into their system to give that to us. And so I think that's why Michelle's point, you know, was a really good one, is I think with some of these additional fields of interest where they aren't part of the national lab standard already, it kind of, I think, would be good to have some careful consideration about, you know, who's the best reporter of that information. You know, it may be that we need to get it from a different source, like case reporting or case investigation first, before, you know, it's available from something like the lab. The lab is, you know, typically not going to be getting that kind of information on a lab order. So those are some of the, I think, the challenges and things to think about.
Great. Thanks for that reminder that we could get that in a case investigation approach and include it there, which I assume would be easier for us to actually program and make happen. So thanks for that.
I'll just add quickly that the estimate that we heard was that if it was collected from a case investigation from local health, it wouldn't add any time to the implementation timeline, but we would still have that 5 to 7 month delay in the rule language.
I think one of the challenges for us is who is going to be providing the information. If we're expecting it to be local public health, that's one thing. But if we're expecting every practice, every test runner for all of these diseases to have that capability, we're not talking about local labs. We're talking about Quest. We're talking about McKesson. We're talking about huge national and international testing organizations. Again, I am absolutely in support of us adding the data, but I do have concern that the rewrite of this notifiable condition element involves 100 different diseases that we need to do something about sooner than later.
Thank you, Tom. So again, board members, we've heard a lot of information. We've heard about the system constraints, which I know is frustrating, but it's a real consideration that we have to be aware of. So again, with that, I'm going to redirect board members. We do have a recommendation from staff that is consistent with the answers that they've provided you here today. And otherwise, another motion would be entertained by the chair.
I'd like to make a motion and that the board directs staff to continue working with subject matter and community experts, local health jurisdictions, and the regulated community in order to help staff develop language to include disaggregated race, ethnicity, and language as reportable data components in the notifiable conditions rule. The board directs staff to withdraw the supplemental CR 102 filed as WSR 20-13-062 in anticipation of filing a new CR 102 to incorporate the additional reportable data components following board review of the proposed revisions.
Second.
Thank you, Fran and Tom. We have a motion and a second on the floor. Further discussion. Well, I'll just add that as an administrator of a local public health agency, collecting data for which our systems are not set up to be able to accommodate that data, I think while borders on impossible, it also will frustrate users down the road or affected populations down the road when we can't act or report on the data. And having been an agency who at one time made that mistake where we required reporting when our systems were not set up to do it, and having literally stacks of paper from floor to ceiling filling up a room, and then having to deal with that paper later, it's huge. And again, I understand this is very frustrating because it's such a huge endeavor, but I would offer that if we're going to do this right, we need to do it right. And based on all the information that we have in front of us, I think the motion on the floor and the recommendation from staff is a good one, and I intend to vote for it. Other comments from board members? Okay, hearing none, we'll call the question. Did I hear another comment?
No, I just said call the question. I guess just as you started saying it. Thanks.
Okay. Yep. You're welcome, Steve. All right. All those in favor of the motion, please say aye.
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 Opposed, please say nay. Abstentions, please state your name. All right, motion carries. Thank you.
I think Stuart's sitting out there wondering if there's any rule revision that's going to take longer than his.
Oh, my goodness. They are big endeavors, no doubt about it. Okay, with that, we are moving to agenda item number 11, which is the 2021 legislative statement. Executive Director Davis.
Thank you, Mr. Chair. So board members, these items are in your board packets under item 11. And every year, the board adopts a sense of the board for the upcoming legislative session. And what this document does is it guides staff activities during legislative session. So I know that we are a little bit behind on our agenda right now. And what I would like to say is I'm going to just say a couple things about legislative session and remind you about this particular document, but we're not taking action today. We're going to come back, and in January is when we'll take action on an updated 2021 legislative statement, and we'll discuss it at that time. So between now and then, what I'd like you to do is I'd like you to review just the 2020 statement to get your arms around what that document is doing to direct staff activities. And then I'd like you to send me your comments and edits so we can develop a new 2021 statement. And just really quickly, since it is 2021 is an odd numbered year, it's going to be a 105-day session, I believe. And it begins on January 11th. So that's 2 days prior to our board meeting. And during odd numbered years, the legislature and governor developed the state's biennial budgets, and state agencies began submitting their budget requests in August. And then the governor would be releasing his budget by December 20th of this year. I wanted folks to know that there are going to be a few legislative committee meetings this month and in early December. And also in early December, legislators can start pre-filing proposed legislation. And so this will also help inform us as to what topics may be coming our way this legislative session. And with COVID-19, I know that the format that the legislature is going to be utilizing is different than what we currently know. And I'm hoping over the next couple months in November and December, we'll get a better sense of what their legislative committee meetings will look like. So in your packets, as I mentioned, was the 2019-2020 legislative statement. And as a quick reminder, in our state health report that's at the governor's office right now, we did have some recommendations for the governor and the legislature. One around foundational public health services. And the recommendation was a continuation and expansion of the initial investments made in foundational public health services. We identified the current gap, and we recommended increasing funding for communicable disease efforts, environmental health, and assessment across the governmental public health system. Also, the board recommended that the governor and legislature prohibit the sale of flavored nicotine and vapor products, including vapor products, to reduce the appeal and use of these products by youth and young adults. The The board also recommended that the governor and legislature fully fund the Washington State Office of Equity in alignment with the task force final proposal. And then a perennial request is that the board urges the governor and the legislature to remove the budget proviso that suspends the updated school environmental health and safety rules, that they prioritize funding for heating, ventilation, and air conditioning systems to improve indoor air quality and reduce COVID-19 transmission, and provide funding so every community has regular school environmental health and safety inspections. So just wanted to put that information out to you, and I welcome your feedback and comments so that we can bring a draft 2021 statement for your review and a hopeful adoption at our January meeting. Are there questions?
Thank you, Michelle. Question for Michelle. This is our usual process.
Yes.
This is Steve. As I read through our priorities, I didn't see one of them that ought to drop off. But I think existing ones.
I think there are some that need updates. There has been some changes in recent years. I believe the current statement refers to HIV AIDS modernization. That law passed. I think it also may refer to tobacco 21, that legislation also passed, or there may be some updates there. So I will need to scrub to make sure that it's current. But thank you, Steve. That's helpful feedback.
All right. Yep. Thank you, Member Kutz. Any other questions for Michelle? All right. Thank you, Michelle. Okay. Next, we are at agenda item 13. For those of you following at home. And it is with mixed emotions that this item is on our agenda today. As you heard earlier and you heard last month, Secretary Weissman is nearing his endpoint as being the secretary for the State Department of Health. At the last meeting, some of us expressed, some of our feelings for that, but before you in our packets today is a resolution 2020-01, and I'm going to briefly read that resolution into the meeting minutes, and then I will circle back with the board and ask the board to consider approving this resolution. So, as stated in the resolution, whereas the state constitution established the Washington State Board of Health in 1889, whereas the board provides a forum for developing public health policy in Washington State and is empowered to hold hearings and explore ways to improve the health status of the citizenry, whereas Governor Jay Inslee appointed John Weissman, Doctorate of Public Health, Masters of Public Health, Secretary of Health in April 2013, and Secretary Weissman has continued to capably and faithfully serve the people of our state with wisdom, integrity, and humility, whereas Secretary Weissman has dedicated his career to public health and has strived to improve and protect the health of all people in Washington through his authentic engagement with sovereign tribal nations, partners in local health, healthcare, and others across our state and nation. Whereas Secretary Weissman has reached across governmental public health systems to build consensus and strengthen partnerships and help memorialize these partnerships in state law that recognizes and advances the foundational public health services. Whereas Secretary Weisman has worked to prevent nicotine addiction among our youth by working to change the age of purchase for tobacco and vaping products to age 21 in Washington. Whereas Secretary Weisman has recognized the barriers to care, prevention, and healing that stigma can create and successfully fought for the passage of state law to eliminate exceptionalism for HIV/AIDS. Whereas Secretary Weisman, in response to the injustice and brutality that Black, Indigenous, and people of color experience, declared that racism is a public health issue and has committed the Department of Health to lead its work with a focus on racial equity and social justice. Whereas when the COVID-19 pandemic struck Washington State, Secretary Weisman modeled how to respond to a pandemic using fundamental, evidence-based public health interventions to flatten the curve and open, transparent communication so people understand how to protect one another from the spread of disease. Whereas Secretary Weisman has accomplished this and more during his time as Secretary of Health and as a board member. Therefore, be it resolved that the board recognizes and thanks Secretary Weisman for his dedicated and outstanding service to the citizens of Washington State. So board members, in front of you is Resolution 2020-01. I think, again, just echoing comments that I made the last meeting, I am extremely thankful for Secretary Weisman for all he's done. He's been a true mentor and a peer to me for years now, and he's been an immense benefit to this board, obviously, in the state of Washington, and I strongly recommend the board approves this resolution.
I'd make a motion.
Board member comments.
I'm going to support this. I mean, John, you've made such a difference in this state in the short time that you were in charge of Department of Health. I can only imagine what you would accomplish if you were around a little bit longer.
Mr. Chairman, I move that we approve this resolution and indicate our strong support for the wonderful job that John Weisman has done for us.
Second that.
All right, thank you. We have a motion and a second. Any further discussion?
I only have one concern, Keith. I have never, in the time that I've worked with Dr. Weisman, heard him speak Southern. And when he goes to North Carolina, he's going to have to learn how to speak Southern. So I don't know if he can do that. We'll see.
Hey, listen, all he has to do is talk slower.
Yes.
Y'all just knock that off now, would y'all?
Yeah. He doesn't understand the difference between all y'all and all y'all. So he's got a work to do. Mr. Chairman, I call the question.
The question is called. All those in favor of approving Resolution 2020-01, please say aye.
Aye.
Opposed? Motion carries. Thank you, John, and we wish you all the best in your future endeavors, and thank you for all you've done for us.
Thank you. It's been a pleasure to serve alongside each and every one of you and to serve the people of Washington State. We do amazing work here as evidenced by our passion for the things that we talked about today. And I know we're on strong footing and continue to be. I've stood on the shoulders of many greats before me, and I know that there's a very positive future ahead, so thanks.
All right, well, board members, next we are moving to agenda item 14, which is a topic regarding a complaint against Spokane Regional Health District, Public Health District Administrator. Under RCW 70.05.120, any person may file a complaint with the State Board of Health concerning the failure of a local health officer or administrative officer to carry out the laws or rules and regulations concerning public health. When a complaint is received, the board determines whether the complaint falls within its authority to review, and if so, whether it merits further action. If it does, the board may direct members and/or staff to conduct a preliminary investigation. On November 3rd, 2020, the board received 2 complaints against the Spokane Regional Health District Administrator, Amelia Clark. The complaints, one from Ben Stuckart and a second submitted by Maria Howard, PhD, and co-signed by an additional 162 individuals, both allege violations of Chapter 70.05 of the Revised Code of Washington. An additional complaint alleging violations of 70.05 RCW was received by the board from Ron Tussey on November 6, 2020. Additionally, in your packet are additional letters regarding this item. And in a moment, I will also ask Michelle Davis to read a letter that we just recently received that is not yet in the package from Ms. Clark's attorney. The complaints, as received, specifically allege that the health administrator failed to terminate the local health officer in accordance with RCW 70.05.05W, which reads, the local health officer shall not be removed until after notice is given and an opportunity for a hearing before the board or official responsible for his or her appointment under this section as to the reason for his or her removal. These allegations are in the context of the termination of Spokane Regional Health District Health Officer, Dr. Bob Lutz, on October 29th, 2020. The complainants claim that Dr. Lutz was removed from his position with neither an opportunity for a public hearing or a full meeting and vote of the Spokane Regional Health District Board of Health. In his complaint, Mr. Stuckart provides a link to a press release from the Spokane Regional Health District, which states no vote was held. The complainants also note the Spokane Regional Health District Board of Health's bylaws reflect that the local health officer may only be appointed or removed by formal action from the Spokane Regional Health District Board. The Spokane Regional Health District Board of Health held a special meeting on Thursday, November 5th, 2020, the agenda for which included a possible action regarding the approval of the termination of Dr. Bob Lutz, health officer. At that time, the Spokane Regional Health District Board of Health voted to terminate Dr. Lutz effective immediately. So with that, based on the complaints received to date, the board has a couple options before it. Before we move to those possible options, I would like Michelle to read the letter we received from Ms. Clark's attorney before the board engages in discussion, since that letter is not available in the board materials, at least as of a couple hours ago.
Thank you, Mr. Chair. And I did want to note that we were able to post this to our website. So it is available for our viewers if they would like to see the letter. But I don't know that our board members have been able to access it. And so we have one of our organizers bringing this note up on the screen for folks. And I received this today at 11:35 from Sayer and Fossum, attorneys at law, dated November 9th, 2020, regarding Administrator Amelia Clark, Spokane Regional Health District. It says, "Dear Ms. Davis, I am the general counsel. I am general counsel for Spokane Regional Health District. I am writing in response to your email to SRHD Administrator Amelia Clark, dated Thursday, November 5th, 2020, advising her that the Washington State Board of Health will consider 2 complaints that she violated RCW 70-05050 by removing the health officer without a hearing of the SRHD BOH. On November 5, 2020, the Spokane Regional Health District Board of Health held a public meeting during which Administrator Clark advised the board of her reasons for seeking termination. Dr. Bob Lutz, with the assistance of counsel, was also provided the opportunity to rebut those allegations. The board asked questions of both the administrator and the health officer, and after deliberation, the board decided to terminate Dr. Lutz. Administrator Clark did meet with Dr. Lutz on Thursday, October 29th. She gave Dr. Lutz until Friday, October 30th at 4 to resign, or she would seek his termination. She did take SRHD property from him. Because Dr. Lutz did not resign, he was placed on paid administrative leave pending a meeting and decision of the SRHD Board of Health. Please feel free to contact me if you have any further questions regarding Sayre, and Fossum, PS, Michelle, K. Fossum. So board members, in your packet, you'll find the cover memo as well as the board's policy for how we will handle complaints against local health officers or local health administrators. I did ask if there are questions about the board's authority on this issue for our legal counsel to be available to respond to those. I didn't know if that would be helpful for the board or for those folks who are following today's meeting. Are there,
Yeah, thank you, Michelle. I also wanted to note for the public that Dr. Lutz is also a member of the State Board of Health. And with that, it means that State Board of Health members know and have a working relationship with Dr. Lutz, which puts the board in a somewhat awkward position with respect to this matter. So before we consider our options for action in response to the complaints, do board members have any questions for the board's attorney, Lilia Lopez, that she might be able to help walk us through?
I have one. Is this, in fact, the sequence sounds like it is outside the rules of the WAC, and yet they did hold a board meeting and they did fire him. Does that mean this is a moot issue, or do we still need to consider this as an active issue?
Hi, board members. Can you hear me?
Yes, ma'am.
Okay. Hi, Dr. Pendergrass. That is something that this board can think about, whether or not the local Board of Health actions have resolved the complaint. That is something for the board members to think about. You have the authority under 70-05120 to consider complaints against an administrative officer for refusing or neglecting to obey or enforce certain public health laws, including Chapter 7005 RCW. So it is within your discretion to think about whether or not at this point you feel that what the local Board of Health did resolve the matter, or whether there is something here that makes you want to direct that a preliminary investigation be undertaken. I do want to mention, just as long as I'm talking with you, that the board does not have authority over what the local Board of Health did. but I'm happy to answer any other questions that members might have.
Thank you, Lilia. Vazaskia, did you have a question?
I did. So for clarity, just for clarity for myself, we do not have the authority for him to be replaced back into his role if we found that it was unjust or that they did not follow the protocols that were out there.
Correct. What the State Board of Health is looking at is just the actions by the administrative officer, by Amelia Clark, not by what the local board did. And the only authority the State Board of Health has is removal of the administrative officer if this was ever to get that far, but not to impose reinstatement of the local health officer.
So the investigation would only be on Administrator Clark's handling of the termination.
Correct. Correct. Yes.
And based on the letter that we just received here, well, I guess I shouldn't go that far deep into it, but based on the timeline of her actions first, and then bringing it to the State Regional Health District Board, we would need to look at that timeline, right?
Right.
Right. She followed the protocols that she was supposed to.
Correct.
Okay.
Under the provisions of 7005. Yep.
Yes, under the provisions. Oh, thank you so much, Ms. Lopez.
You're welcome.
Okay, and I was remiss, and I should ask this before we continue going forward. Are there any board members who feel the need to recuse themselves further from this discussion?
So this is John Weisman. I don't feel the need to recuse myself from this discussion, but other than to acknowledge that I know both entities, you know, in this, the health officer and the administrator, and to know that I've had occasional brief conversations with the administrator where she has indicated over some period of time some concerns. So in just full disclosure, I've had some of those conversations. I'm not intimately involved in any of the processes there or given any advice. And unless Lilia says would recommend differently, I feel able to move forward in making a decision, but I did want to disclose that. So Lilia, happy to take any advice from you if you think I need to do something different.
Okay. I think that I would answer that by saying that the legislature has set up this process for the State Board of Health to undertake. At the same time, it's also set up the State Board of Health to have members, including a local health officer and others who might be administrative officers and the Secretary of Health, all of whom tend to work together. So I think we can assume that the legislature was aware of both of those different sets of authorities. And having said that, I think it's a good idea for board members to just consider whether they feel that they have some sort of personal conflict of interest that would adversely impact their ability to, you know, carry out their official responsibilities with respect to this issue.
Great. Thanks. With that, I feel like I can carry forward with the official responsibilities.
I did want to bring to the board's attention that this weekend, and even as we have been meeting today, we have continued to receive correspondence on this issue from a number of people, and I understand there may be additional complaints against the administrator that as a staff we have not been able to review as we've been meeting with you today. So I just wanted to identify that issue for you all as well.
Yeah, this is Steve here. This is the most difficult situation because and so we don't always have the ability to do some things. But I'm looking in here, and so I know that they have the authority to do that. And we want to make sure that the rules were followed. But I also, in reading some of the things, heard some things that made me think that the second paragraph of the rules and remedies because there's also some responsibilities for the State Board of Health in this difficult COVID thing. And so I was reading some stuff in there where they were trying, it sounded like he was being pressured to change his opinions on some things. And so I know that there's no allegations specifically on that, but I am going to support opening a investigation on this.
Steve, are you making a motion?
Yes, I would make that as a motion. Let me see. Yeah, I'm under, let me see what, under what rule we're under. We're under,
Tab 14.
I just had it in front of me, sorry.
I have a point online right now if you'd like me to make the motion. Steve?
Yeah.
Would you like some help from
Yes,
Brad?
I'll say, yeah, why don't you go ahead and make the motion because my stuff went flipping all over the place, but yeah.
The board determines that an investigation is warranted and directs staff to conduct a preliminary investigation under RCW 70.05.120 and report their findings to the board.
Okay, we have a motion.
I'll second.
And a second. Further discussion.
So this is, oh, go ahead, Tom.
Go ahead, John.
So first of all, I guess I want to say that I think overall, sort of this COVID response and pandemic has been incredibly challenging for many individuals, those who work in public health, those who don't, who have been affected by this. And I appreciate the passion in which folks are coming forward with concerns. I think it's very distressing and concerning that two professionals here are challenged as they are at this moment in time during a pandemic when our energies and resources really need to be focused on combating this virus and continuing to save lives. I know the work that folks have been doing in Spokane has saved many lives, and there's much more work to be done. And, you know, as the Secretary of Health, in general, I'm very concerned that the pressures that administrators, that health officers might receive from communities, from elected officials to whom they report in terms of trying to I guess, ask folks to make decisions that aren't necessarily in the best interest of science and that balancing of public policy. I have spoken to, you know, many an administrator and health officer during this pandemic where it's been incredibly challenging to do their work, been incredibly challenging as folks have tried to describe what we know and what we don't know about this virus, what we know or don't know about interventions that we might implement, and the enormous responsibility that our public health officials have, whether they're administrators or health officers, in trying to address this pandemic. The pressures are immense. At times, there is community support. At times, there isn't community support for these things. And it takes an incredible toll on individuals and people who are trying to do their best every single day of this work. And I know that we have a governance system set up in this state that has independent local boards of health to govern locally these decisions, and I certainly need to respect those and that. I think that this pandemic has said to us there are a number of things that as we go forward we need to examine about our system. We need to examine how we fund public health to do this work so that we can have the staffing resources and the expertise to combat a pandemic like this, not to mention the everyday work that we need to do in our public health roles. I believe that it asks us again to look at governance of our public health system. Do we have the right governance structure in place in terms of how we are organized? And I don't have answers to those questions, but I do think that in the future, those things need to be examined. I am concerned about sort of how things have transpired. I don't think, certainly I don't have the facts. And I think that for the community, it's important to get our best sense of transparency here in terms of what really happened. And the only way I think, and the only group that can make that happen right now in an independent manner is the State Board of Health. So for those reasons, I do believe we need to at least do a preliminary investigation to see what we can do to find out about increasing the transparency, understanding the issues and the facts as best we can. That said, I also believe that when we look at our determination, down the road, one of the options is, for the officer to remedy the failure. And if indeed, and again, I say if because I don't believe I have facts to be able to know, if Administrator Clark did sort of err in the process of addressing this personnel matter, it feels like it has been remedied, that the Board of Health did have a hearing, that the Board of Health did make a decision, so that this has actually been remedied. That said, I do intend to vote in favor of a preliminary investigation for the sake of community, I think, in terms of transparency and understanding what happened, and for the board to give that further consideration. And I guess along those lines, and I am and believe that the board should have a discussion about whether or not board staff or board members are the ones who should be doing this preliminary investigation. I believe it's probably in our best interest to have an independent entity that we hire do this preliminary investigation for us for a number of reasons. One, we are all trying to actually combat this pandemic. And I don't believe, right now, I believe all of our resources need to be focused on our public health work for those of us who are on this board and for the board staff. And then secondly, you know, we all have relationships with these individuals. And I think for the best of objectivity, it's probably best that we look at hiring someone to do that. And I think the board ought to have further discussion about that. And if we did go in that direction, I would certainly work with the department and the Office of Financial Management and others to make sure that we had the resources that we could do that. But the community is obviously very concerned about this and has expressed that. And I think we owe it to the community to do our best to get the facts and to make sure we have the transparency that's needed. And with that, I'll end my comments there.
Thank you, John. Tom, did you have a comment to make?
Just to follow up on John's comment, I guess the challenge for me was the proper sequence used in the discussion about termination. The information we have both in the attorney of the administrator and the material we received suggests that the sequence was not followed, that the termination occurred actually before the board meeting, and the board meeting was just verifying that. The other allegation that is made is about the quality of the interim health officer and his qualifications, which is also in 70.05. So I rise to say, I believe an investigation is appropriate, should occur, and I'm excited that John is willing to believe that that's better done by an independent individual than those of us on the board who are also engaged with these people.
Thank you, Tom. Go ahead, Lutz. Yep.
I just want to say, I would echo everything that John said and Dr. Pendergrass has said as well. And I just think that the voices of the community and the concern there warrants that we do the right thing and elevate the concerns as well. We've all looked through the materials and there's some concerns with the timeline. And I do definitely agree having someone outside do the preliminary investigation. So very much in support of also supporting the concerns of the community.
I also think that an independent investigation would be appropriate, and hopefully that the financial department will be able to will access some funds for us to do this, because I know that the funds are not within the State Board of Health. So, but I do want to reiterate that independent investigation should be done.
So I just have I guess a comment along that vein. I guess to a certain extent, where the administrator, so it's pretty easy to have somebody look to see where the administrative policies followed. My guess, there's way more issues than just that of a public health nature that might have led up to this. And so I want to make sure that we have somebody coming with a strong public health background, understanding how local politics play into all of these things, does the investigation, I guess. Not just some, maybe some attorney that just goes to look, did they follow the letter of the law?
Also, Steve, along with that, I did not see anything in the meeting that the board held as far as personnel policies, following personnel policies, or any progressive discipline plan that the board has, or any kind of solutions or remedies that was offered. So I'm concerned about all of those questions as well.
Keith, can I just make a comment?
Yes, please.
I just wanted to remind folks that the board's authority in this regard is with respect to the administrative officer's actions and not with respect to the local board of health.
What I would say, unless somebody makes an allegation to that also, because the state board, the local board of health does have some responsibilities to uphold public health laws. That's in paragraph 2, I think. I was looking at that. I was attempting to do a little bit of reading, but unless you subscribe to the spokesman's review, you can only read one article. But there was, let me find it here. It's it's the part where it says, I'm almost there. So under RCW 70.05.120, number 2 says any member of a local board of health shall violate any of the provisions of chapters or refuse or neglect to obey or enforce any of the rules, regulations, or orders of the state board of health. So that maybe that's not, but it's under the suppression or control of any contagious or dangerous disease or for the protection of health of the people of this state. So I know he was under intense pressure to open the schools, for example. You can read it. You can read it, and it said so in the newspaper. So I don't know if there was anything that went on in the background, because I just want just the facts to come before us. That's all. As best as we can have, and make sure that it's not like we're not holding hearing on somebody on whether they should be in prison after they're already in prison. Maybe that's the wrong corollary, but that's what it seems to me a little bit.
Thank you, Steve. I will point out that I think if under the current motion that an investigation would have to be into the complaints lodged with the board. I don't think this, and Lily, I could use your help with this. I don't think this would be just like this broad open investigation where they would just be digging, looking for wrongdoing. It's our job to look into the allegations submitted by the members of the public as of today, as of the record we have today, correct?
That's correct, and only those complaints against the administrator, because again, there's no authority with respect to the local board of health. And we can finesse the motion if that would help to add a little bit more specific language there.
Well, I did hear some complaints from Dr. Thorburn regarding a former public health. So maybe she wasn't talking about Board of Health. Maybe she wasn't talking about the current one.
Right. I know there are complaints in the packet. Right, correct. There are written complaints in the packet on the website about the local Board of Health. And I understand that folks do have concerns about the local Board of Health and the actions that they took with respect to the local health officer. But if you look at RCW 70.05.120 subsection 1, that's where the State Board of Health authority lies in this respect. And it only is with respect to actions taken by a local health officer or an administrative officer. So here, the state board does have complaints against the administrative officer that it can determine what to do with. So I hope that helps.
It does. Thank you, Lilia. Jill.
That's why we want you online with us.
Thanks, Keith. I think that it is our obligation and our responsibility to move forward with an investigation. How that works, is that internal or external, is the way that it was proposed by Secretary Wiseman. I think whichever way is the most optimal. We know that this is going to be exceptionally time consuming for a lot of different parties engaged in this. And so whichever way is going to be most optimal, but I will be supporting moving forward with an investigation.
Thank you, Jill. Okay, and I will just say I support all the comments I just heard. I also agree that I think an independent investigation at this point is warranted. I appreciate the Secretary's willingness to help the state board find the funds to hire an independent person to do that investigation. So with that, I will call the question. All those in favor of approving the motion to conduct a preliminary investigation, please say aye.
Aye.
Aye. Those opposed, please say nay. Members abstaining, please state your name. Okay, motion carried. So at this point, I guess Michelle and I will circle back with Secretary Wiseman to look into how we go about hiring that independent investigator. And we will report back to the board as soon as we have additional information. Michelle or Lilia, did you have any last comments on this matter before we move on?
I would just say that, as I mentioned, the board has received a very large volume of comments on this particular matter, and we understand that there are additional complaints, I believe, related to this case. And so as we continue to delve into those comments, we will update the board. We will be responsive to those complainants and alert folks that the board decided to pursue a preliminary investigation, and we will have more details for you as we move forward. Thank you.
None for me.
All right, thank you, Lily. I appreciate your help. Okay, board members, agenda item 15, board member comments. Would anybody like to make comments for the good of the order?
Two. I think we have been blessed to be able to work with John Wiseman. I'm sorry to see that he's going to abandon us to go off to the Carolinas. Second point, I really do want to compliment Rodakina and Alex and Sam. The work on the reportable conditions was long overdue. It's a complicated, multi-long list, a variety of diseases and conditions. I think they've done truly outstanding work, and I appreciate the fact that we're continuing to give them work to do.
Thank you, Tom. Other board members?
So Keith, I just want to thank you for your leadership on the board and helping us navigate these issues along with Michelle Davis, all the issues we get to do, which are a wide variety in nature. Both of your leadership, the two of you, is amazing, and I appreciate what you do to lead the board through all of our work. And a shout out to the State Board of Health staff for indeed the high quality of work they do. It's impressive. These are challenging times to work in as well, and the work continues. Also shout out to the Department of Health staff who assist with that work as well. And I guess just my imploring everybody out there, we are in a pandemic. As my report stated earlier, our cases in Washington state are quickly rising. I ask and personally plead to everybody in this state to please take personal responsibility. Please do your part to prevent acquiring or transmitting this virus. And as a reminder, we can feel well and healthy and still be infected with this and transmit it to others. So I need everybody please doing their part. We want to save lives. We want to make sure that the ones in our communities that are providing our essential services are able to do so safely, and appreciate everything you do to help us see through this. I know our patience is wearing thin. I know there are many impacts to the economy, to people's lives, to our mental health, our behavioral health in general. And all of those things have to be weighed, our educational health, et cetera. This is hitting us at all angles, and we need all of us pulling together on every single one of these pieces to make sure that we can see ourselves through this, and I appreciate everybody's help in doing that.
Thank you, John. Last call, board members. Any other final comments? Okay, seeing none. Yeah, I'd like to just echo a lot of what John just said, especially with respect to some of the comments we heard today during public comment about, while I understand that there are some individuals where wearing a mask is a challenge, and I think what the governor and what the secretary have put out there has allowed for those individuals who are challenged with wearing a mask. They have made provisions for those. Unfortunately, the bottom line is, as John was saying, we are in a pandemic. This is a very contagious disease. We're seeing that. We're learning more about it every day. We don't know everything about it. One of my peers in our Kitsap County Emergency Operations Center is on a task force for FEMA. And his task force was recently deployed to El Paso, Texas, to help with their situation down there. And for those who have not read into that or heard about their situation, I would encourage you to Google it and take a look at what can happen when there are weaknesses in our overall community response to this pandemic. A response to a pandemic requires that all of us give up a little bit of our individuality for the good of the whole. And the purpose of wearing masks and staying distance and all these other conditions and restrictions that we've put are twofold. One, it's to prevent disease, which is our legal charge. That's another thing people seem to forget, is we are legally mandated by the state to prevent the spread of disease, and that's what we're trying to do. Second, when we don't have the community's help to control the spread of disease, people lose their lives. And with this disease, what we're seeing is that while yes, the biggest risks are to those who are elderly or with underlying health conditions, that is true. But what we're also seeing is that this disease can randomly select people that may not be old or elderly, may not have underlying conditions, and can wreak havoc on their body. It can cause clotting, organ failure, and there's no rhyme or reason to who that disease picks to make those manifestations become real. And what we're trying to do is make sure that we have hospital and medical and healthcare capacity so that those who need the help can get the help. And what they're seeing in El Paso, what they've seen in Madison, Wisconsin, is that when the public as a whole cannot combat this disease, and cases are coming in faster and are more serious than what the healthcare providers can handle, and what local health can handle is that people who don't need to be severely impaired from this disease and don't necessarily have to die may end up dying because there's no capacity to help them. And that's what we are desperately trying to avoid here. And so again, I would just echo what the secretary said and just beg everybody, especially as we're approaching the holidays, you know, if you can just give up a smidgen of your individuality for the good of the whole, you know, we could maybe get on top of this once again and open up our economy and help, again, everybody out at the same time. And with that, I'm going to get off my soapbox and just last comment. Again, thank John for his leadership. It's been invaluable. I wish you all the best, John, and look forward to possibly hearing from you in the future. Board members, do we have a motion to adjourn today?
I do. I motion that we adjourn the meeting.
I'll second.
We have a motion and a second for adjournment. All those in favor of adjournment, please say aye.
Aye.
Aye. Opposed, please say nay. All right, this meeting is adjourned. Thank you, Board of Health and Department of Health staff. You did a wonderful job again. If only the rest of us could do as good as you guys do, we'd be great. But overall, excellent work, and thank you very much. Everybody stay safe, stay healthy, have a good holiday season, and we will talk with you soon.
Thanks for all you do, Keith.
Bye.
Thank you, Keith.
Thank you all.
Was your microphone off or on?